if a woman has completed her family size, she has completed her family size, and she's satisfied with the number of children she has, and the woman is very symptomatic, having recurrent heavy menstrual bleeding, having huge abdominal swelling, the best option would be to what? To remove the womb. Yes. And also, you also take, this part of the world, then there's a lot of cultural things to some of the things we do. Many women want to keep their womb till the next life and all that. Some of them, when you counsel them, they'll tell you, this is my womb, you will not remove it. I want to have a womb when I come back to my next life. So a lot of things happen. So you must also have this cultural sensitivity and all that. You shouldn't be pushing. You should give the best, at that particular point in time to the woman. If you consent to your procedure, then you perform it. But by and large, the common reasons why people perform myomectomy, which is conservative surgical, is to preserve that womb for the woman to actually get pregnant. It's a fertility sparing surgery. The second reason why you may want to perform the procedure is probably you see that the mass is becoming so large, it's so huge, it's compressing the kidneys, it's causing hydronephrosis, creating a lot of problems for the woman. Even when that woman has completed her family size or close to her menopausal age and all that, you need to find a way to remove that mass, to perform that surgery for that person. Otherwise, it's going to damage vital structures in that patient. It's one of the major. And then a woman who is having very heavy menstrual bleeding, you may also want to perform the procedure for them, particularly the submucous type, the ones that are located inside the cavity, are more likely to cause heavy bleeding, and such fibroids should be removed. Outside that, there are indications for use of medical therapy. Women you want to use medical therapy are one, to control symptoms. Because I told you that fibroid could come with pain, very severe pain. So, and there are medications that can be used very well to control pain, like the non-steroidal anti-inflammatory drugs. They control pain very well. And some of these drugs, apart from controlling pain, they also control heavy menstrual bleeding. Particularly when you combine them, NSAID, tranexamic acid, mefenamic acid, and all. When you combine NSAID and other medications, they could control both the pain and the bleeding very well. Some of these drugs are non-hormonal. Some of them are also hormonal. Some of these drugs, you can take them orally. Some can be given by injectable method. So whichever way is just to control symptoms. That's one of it. The second reason why you may want to use medical therapy is this. A woman is around her perimenopausal period. She's around 50. She's 49. She's 50, she's 51, and you know that this man will soon enter menopause. Average age of menopause is about 51 years old, and it's constant worldwide. Average age of menopause. You know that this man will soon enter menopause. It's possible that, when you give some of this medication, they can shrink the fibroid mass. When you give gonadotropin-releasing hormone analog and some other hormones, they can actually shrink and reduce the size of the fibroid. The reason why it's not effective in people who are still really desirous of fertility is that the drugs are anti-fertility drugs, and sometimes when you leave them, after giving them, they can grow back within the space of 6 months to 1 year. So by the time you notice that the hormonal milieu of these women are going down, particularly women who are around their perimenopausal period, it's possible and it's very easy for you to administer such medications like gonadotropin-releasing hormone analog. Once you give such medication, it shrinks that fibroid mass and obviate the need of even to operate such a woman, because the fibroid is already going down. And you know that when the woman enters menopause, the estrogen level falls, the progesterone level falls, and these are the hormones that potentiate the growth of this fibroid. So you can give them, and probably you may not need to give the perform any surgery on those women. So women who are around their perimenopausal period or just entering their menopause, you can use medications to control those symptoms and prevent you from performing a surgical procedure on them. The other reason why you may want to use some medical therapy is women who are in quote not so fit for a surgical procedure. You can continue to give them some medications. Women can have very symptoms of fibroid and have a cardiac problem, heart problems, and some medical conditions that may not allow you to take them to the theater immediately. Until you're able to stabilize them, they are not stable enough for the surgery. You may then decide to perform the procedure. So these are some of the reasons why sometimes, one may want to use some of these medications, prior to, in some of these women who are having the uterine myoma, uterine fibroid. And then the conservative approach is the mammectomy, in which you want to remove the fibroid and preserve the uterus. This is mainly fertility sparing, to preserve the reproductive potential of the woman. The other option is to remove the whole womb, which is supposed to be the best option for performing this procedure. And this whole thing can be open or closed. There are surgeries, there are fibroid operation surgery you can perform without having to open up the abdomen. Minimal access surgery. You can perform a laparoscopic surgery, and remove the fibroid. If it's within the endometrial cavity, you can perform hysteroscopy and remove the fibroid without having to open up the women. These procedures have emerged over time. They have advanced over time, and they are easy, they are inexpensive, and the complications are minimal, are less. Complications are there, but in good hands, the complications are very, very few, and not as it was, in the days of of our fathers, when these kids were not really there. So it's not a very difficult procedure to do.
I've been receiving so many questions as you were answering the treatment options, but okay, I will take some together as the one I'm asking right now. Still on the treatment, sir. So somebody is asking right now, let's say she's going for the surgery. After the fibroid surgery, will this fibroid reoccur? So she's scared. What is the chance that if I'm operated, the fibroid will come back? If there's any need to come back, why am I being operated on?
All right. Indications to perform a fibroid surgery should be met. You don't just take a woman to do a fibroid because you want the woman to, or you just want to perform a surgery. First of all, there should be a need to perform that surgery. If that need is not there, no need to perform the surgery. So the chances that fibroid will reoccur is there. The chances is also high. In some cases, it takes a very long time for the fibroid to occur. And this varies for many people. It varies in so many people. Some people take a longer time for it to recur. Some people, within a shorter space of time to also recall. But the chances are not so high. In many cases, if it's for fertility reasons, the person performed the procedure, what we usually advise is that within the space of 2 years, the woman should get pregnant. Because we all understand that nulliparity is a risk factor. Not having a child is a risk factor for developing fibroid. So by the time a woman performs a procedure, and you're still taking up to 4 years, 5 years, 6 years, 7 years, 8 years, the woman has still not gotten pregnant, the chances that she will develop and even be cautious of having more fibroid is there. So we usually say, well, now that we have performed this procedure, you really have to get pregnant. But in some cases, in which the girl is unmarried, you can't force a man into her hands, simply because you are performing a procedure. You can only reassure her and tell her that do the best you can, pick out all the fibroid and be hopeful. Sometimes for such women, what we usually do is we'll see whether we can control the symptoms using medical means in the meantime, pending when she's, prepared to actually get married, or except the fibroids are huge and are also already causing, pressure symptoms, causes some problems for the lady. But if it's just for menorrhagia and the fibroids are few, some of those fibroids can be controlled using medication, depending when the woman is actually ready, to have it done, or when the woman is married.
There is this thing we always hear everywhere. They'll tell you that there's a fibroid curing tea or a fibroid melting tea, or when you take this medication, it will melt the fibroid. As an expert, what is your opinion on that, sir?
There are so many things we hear, very many. The things we hear, even God will be shocked at what we hear.